Getting rid of lower back pain involves several strategies that can help relieve discomfort and improve your mobility. So here are some effective methods. Number one, I got to start with rest and relaxation. I mean, take short breaks from activities that worsen the pain. However, avoided prolonged bed rest can weaken the muscles. Number two, ice and therapy. Ice and heat therapy. So, ice and heat. Let's start with ice. Apply ice packs for the first 24 to 48 hours to reduce the swelling, then the heat. After the initial pain subsides, use a heating pad to relax tight muscles. Number three, gentle stretching. Engage in gentle stretches to improve flexibility. Focus on the hamstrings, the hips, flexors, hip flexors, and lower back. Now, number four, strengthening exercises. You got to strengthen your core muscles with exercises like planks, bridges, pelvic tilts to provide better support for your back. I'm going to leave it all in the description so you can look up these exercises, but those are the ones you need. Number five, maintain good posture. Pay attention to how your posture is when you're sitting, when you're standing, when you're lifting. You know, so number six, let's go with that. Stay active. Regular low impact activities like walking or swimming can help keep your back healthy. Did you know that? Number seven, over the counter pain relief. Non prescription medications like ibuprofen and another one I'll leave in the description can help manage pain. Number eight, consult a professional. If pain persists, consider seeing a healthcare provider, a physical therapist, or a chiropractor for further evaluation and treatment options. Now, always listen to your body and avoid activities that cause increased pain.